enemy.
Leading off our discussion tonight, Kristof, Pulitzer Prize-winning columnist for the New York Times. He has been interviewing the people on the front lines, doctors, nurses, about the coronavirus. Also with us, Dr. Amit Phull. He is an ER physician, emergency room physician at Northwestern Medicine in Chicago. Dr. Phull, what is your sense of where we are on the front lines tonight, especially in terms of supplies, necessary supplies for the safety of the physicians, the nurses, and others on the front lines, others working in the hospitals?
It's a very difficult situation, Lawrence, I'll have to admit. I'll say in my own personal experience, I was in the emergency department last week. I did not myself run into any problems with having limitations to my access to the equipment that I needed personally. But certainly, reports that I get from friends and colleagues of mine, a very large study that was conducted by a company that I work for that sampled the entirety, frankly, of the physician user base and had responses from across the country, is reflecting the practical reality being somewhat disconnected from some of the things that we're hearing and some of the things, frankly, that you covered kind of in your opening there. I think what's missing, frankly, is that plain talk. I appreciated the conversation you had with Rachel. We need to just have a plain conversation about that reality in order to ensure that folks, particularly those first-line responders, are aware that other people are aware of their circumstances at that front line.
And Doctor, what about the medical equipment? In addition to the safety equipment for the people working, what about the necessary medical equipment that needs to be distributed to the states that need it the most?
Yeah, I mean, it's a difficult situation. Again, I mean, it's complicated in the United States to answer that question holistically. I'll say from my own experience in Chicago, we had the benefit of some time. We had a little bit of lead time that our colleagues and our brothers and sisters in New York and New Jersey did not necessarily have. I have a very close family friend who actually works at Elmhurst Hospital, and the reports that I hear from him are very dire in terms of there being shortages. And I know everyone's seen the pictures on the news as to how dire that circumstance is. But what I can say is in Chicago, we're trying our best to stay at least one day ahead of the surge. Everyone is reflecting kind of the modeling that's up to date nationwide, and individual states certainly make decisions based on that data as well. So we're doing the best that we can, but this pandemic has certainly overwhelmed the healthcare system at a wide variety of places across the United States. And yeah, we are not well equipped, frankly, to respond with the appropriate amount of technical equipment or machinery, frankly.
Let's listen to what Governor Andrew Cuomo just told Rachel in the last hour about basically the Trump position that the federal government, Donald Trump, is just a backup to the states. Governor Cuomo says that that is not the way to do it. Let's listen to this.
Where we are now, 50 states all trying to buy the same equipment from China, and then the federal government comes in with FEMA, which is trying to purchase the same equipment. This is not the way to do it.
Kristof, it sounded good at the briefing at first today when they said 200,000 masks, N95 masks on the way to New York. They'll have them tomorrow. And then with questioning, you discover, well, they're going to a warehouse up there, and then the bidding will start.
And indeed, it may be foreign bidders who end up with those masks, not even American bidders. I mean, look, I admire people like Dr. Phull so much. I mean, the heroes of the moment at this time in the U.S. are those frontline health workers, doctors, nurses, but also, frankly, technicians and cleaning staff. And we do them an incredible disservice when we send them out without proper protective equipment. And I'm just pained to hear the stories that they tell about putting themselves at risk because they can't get basic equipment. And, you know, I mean, protocols in this country are much less rigorous than those for Chinese doctors and Chinese nurses right now. And maybe to top it off, when American doctors and nurses complain, they're now being fired or disciplined for raising those issues, for speaking up. I just find that, you know, unconscionable. And, you know, when you are dismissing workers at a time when you most need them, it's not only unconscionable, it's also idiotic, frankly.
Yeah, Nick, I read that in your reporting, speaking to people who've run into trouble because they kind of publicly complained, either in social media or other ways, about, we don't have what we need. And then the hospitals that they were working for had a serious problem with that. You report on one of them anyway, when it became public that they had let that doctor go. They then took that doctor back because they didn't like the way it looked. But it's a very, very strange situation when you have doctors out there kind of fighting for themselves on social media and other ways publicly, and then they get in trouble with the administrators.
And then they're not only fighting for themselves, which they have every right to do, but they're also fighting for patients because, one way to protect patients is to have proper PPE for the physicians and to use it properly. And so I'm glad that you have doctors like Ming Lin in Bellingham, Washington, who were raising these issues. And now he's been terminated. He doesn't know if he can be hired again at another Seattle hospital. In New York, at Weill Cornell, you had a ER doctor, Anya Rimwilski, who she didn't even protest publicly. She simply wanted to bring in her own PPE to try to protect herself. And she was sent home, like a 7th grader violating the dress code. And I just, at a time when so many doctors and nurses and others are risking their lives for the rest of us, then to deny them the equipment that they need to keep themselves safe, and in some cases to fire them for speaking out, is just outrageous.
Dr. Phull, can you give us any insight as to what hospital administrators are thinking in those situations? What is it that they're so outraged by in these kinds of cases?
Lawrence, that's such a difficult question to answer. What I can say, I'd like to say a couple things, actually. First off, Mr. Kristof, I'd like to thank you for your piece today. I read it. Some of the things that you reported on, frankly, broke my heart. That's not consistent with my own personal experience, which is the N of 1, but I am certainly aware of other colleagues in the field that have run into this kind of difficulty. And it's quite obvious that that's not how we should be handling these situations. You made a very critical point in your statement there that it's not just about frontline healthcare workers. A sick provider provides a risk to a patient. The last thing that you want a patient to have in the back of their mind is a consideration that they're not only going to the hospital to potentially be treated for something, but they're at risk of catching something from the hospital. That is a just untenable situation for us to get out on the other end of this. To your question, Lawrence, it's difficult to say. As an ER physician, you're trained to handle a wide array of circumstances, and more than anything else, you're trained to stay calm when you don't know what the hell to do. In this particular circumstance, I'll say the training that's most relevant in my background is also knowing when not to speak out of my depth. I don't know what hospital administrators might be motivated by when it comes to dismissing a physician when, as Mr. Kristof pointed out, the health and welfare of the healthcare force now critical to our actually solving this problem. So I don't unfortunately have an answer for you as to what may be motivating that kind of response.
Dr. Phull, quickly before you go, how do you feel about your own safety day to day?
So I'll say so far I've felt fairly safe. I'm not going to lie to you. In my experience, again, that being said, I'm currently undergoing self-quarantine. When I returned from my last shift, I certainly was exposed in a fashion that I wasn't necessarily prepared for, and I'm now not at home with my daughter and my wife, and we have my parents living with us who are both in their mid-60s, so I had to make the decision to separate myself from them for the time being. I didn't feel necessarily personally at risk such that I had the sense of danger at the front of my mind when I was at the hospital, but I do know that that circumstance is not enjoyed by everyone who's in my position. So I can't speak for everyone, but I do know that there are some unfortunate situations actually occurring on the front line.
Dr. Amit Phull, thank you for your heroism. It's much more than thank you for your service tonight. We really appreciate it, and thank you for joining us. Nick Kristof, thank you for your reporting and for joining us. Really appreciate it. Thank you. And when we come